Hello, Michael Chigani, and this is Straight Talk. With me today is Professor Ben Cowling. Now, Professor, you are epidemiology at Hong Kong University, University of Hong Kong. What does that mean?
I'm an epidemiologist. Yeah. It means I study how diseases occur, how they spread, particularly infectious diseases, how they spread from one person to another, how epidemics occur, and what we can do to stop them from occurring, or at least to slow down their spread.
So that's different from being a microbiologist. You actually study how diseases spread, right?
Yeah, so there's a lot of doctors around and microbiologists who look at individual patients or individual viruses through microscopes. What I do is look at the population level. So how does infection spread among the population, and what kind of measures could we take? So I do a lot of analysis of data and collection of data.
And you're with the University of Hong Kong, right? Okay, so now we understand what that means. Everybody wants to know, is this coronavirus going to end? And if yes, when?
I think it's going to be a long battle against coronavirus. For Hong Kong, we can keep it out for quite some time. Some other countries, some other places in the world may be able to keep out coronavirus for some time, but other parts of the world will not be able to. So there's always going to be a risk that coronavirus comes back to Hong Kong, even if we get it out and we get down to very low levels. So I think for the coming months, we're going to have to be on high alert to avoid having...
You said coming months?
Months, even a year or more, even a year or more.
It's not going to suddenly disappear in the summer like SARS.
It's not going to disappear in the summer.
Why do you say that? How do you know that?
So SARS was a very different situation. SARS, we managed to get it away with all of the effort made by the public health authorities, made by doctors and nurses in hospitals to stop it from spreading. We can't do with that with coronavirus. It's too difficult. Actually, in Hong Kong, we're doing a really good job at the moment. We're keeping the numbers to a very low level, but elsewhere in the world, it's much more difficult. Hong Kong, we have a lot of infrastructure since SARS. We're probably one of the best places in the world at dealing with COVID-19, one of the best places in the world. But other parts of the world won't be able to do as much as we're doing in Hong Kong. So it means that even if we could get it out of Hong Kong, it will still come back. So it wouldn't be like we get the numbers down to 0 and then we can go back to normal, because then it will come back in from somewhere.
So you're telling us we can never go back to normal?
So there's two things that can happen that would mean we can relax and go a little bit back to normal. The first thing that could happen is we get a vaccine. And there's a lot of really smart people now making a lot of effort to get vaccines. There's so many different candidates being tested around the world, but the process is going to take time. It's a long process. They need to test it first maybe in some animals or some volunteers, and then they go out into the general population, test in small numbers and then larger numbers, wait for the results to come back, analyze them. That's months and months and months. And then even if, let's say 6 months' time, they identify a really good vaccine that should work, they still need to produce millions of doses just for Hong Kong. And what about the US, Europe, the rest of the world? That's potentially billions of doses of vaccine. That can't be produced overnight. That's going to take months and months and months. So the earliest we're looking at is a year, more likely 18 months or 2 years. So that's the first possibility. The second thing that could happen is we identify an effective antiviral drug to treat people with severe infection and maybe prevent the milder cases from going severe, the severe cases from dying. If we could do that, if we had an effective antiviral, it would be much less worrying if there were more infections.
But we don't have that yet, right?
We don't have either. We don't have a vaccine, we don't have an effective antiviral. So that's why we're really on high alert to keep the numbers of infections at a low level in Hong Kong.
How scared should we be, Professor?
If you look at New York, that is what could have happened in Hong Kong by now if we hadn't been doing all the things that we're doing. So New York's got 100,000 plus cases, thousands of deaths, and they're still on the way up in their epidemic. They haven't peaked. They've done a lot of control measures now. They're doing the lockdowns, which we don't want to do. So they're going to slow things down. But most likely there'll still be a lot more infections, a lot more deaths in New York before they've even passed their first wave. We don't want to be in that situation. That's why we're doing so much in Hong Kong.
But our cases are also shooting up. At first it went down, then we had a second wave of returnees. What did we do wrong?
I think we were not alert at the very beginning to the possibility that there would be these infections coming in from Europe and the US. And it wasn't only the problem locally. We didn't realize there were so many infections in Europe and the US when there were a lot. And so these people coming back, the Hong Kong residents coming back to Hong Kong, some of them were infected, less than 1% in most of the time. We didn't realize that there were so many infections in Europe because the European governments themselves hadn't realized that they had so many infections. So I think we were slow to get on top of those. Now they're coming back to Hong Kong with a 14-day mandatory quarantine. So if there are any infections, we'll pick them up before they have a chance to spread into the community. But it doesn't mean that there won't be any spread into the community. There's always a possibility that something's missed. Maybe there's a leakage from an imported case into the community, and then it spreads. And what we saw with the bar and band cluster is maybe one infection can spread to 50 more, right? It normally doesn't happen, but on the odd occasion we can have this kind of outbreak, which then sets everything back locally. So at the minute we're having 20, 30 cases a day. Right. That's less than it was, a couple of weeks ago when it was 50, 60, 70 cases a day. We've done well to bring the numbers down. I think in the coming weeks, unless there's a large outbreak, unless there's another surge, most likely it'll keep going down, maybe into the teens instead of the 20s. But I don't think it will go away. And I think, that there's going to be this constant, the constant changes in the control measures, maybe tightening them when the case numbers are going up a little bit, maybe relaxing them a little bit when the case numbers come down. But I don't think we can expect all the measures to be relaxed, because if that were the case, then we'd start on the trajectory of New York.
Well, you say we can't relax all the measures. Bernard Chen, the convener of the Executive Council, actually said that we may be looking at lockdowns. I mean, non-essential businesses should close. He said it's not here yet, they're not doing it, but he said that that's something that the government may have to do.
I think that's an option in the back pocket if it's needed.
We don't need it now, do we?
We don't need it now, and I don't think we're going to need it for quite some time, because we're doing really well with the measures that we've got. The two types of measures that we're using in Hong Kong to keep numbers low, the most important, testing, finding the cases, tracing their contacts, and then doing quarantine in the contacts. It's quite a drastic measure, but it means that if a contact has been infected, we stop it there. It doesn't go any further. That's the concept, and that's working well. And then we're also doing this social distancing in the community. So even if we do miss some cases, which is always possible, if there is spread into the community, it'll be kept at a low level, giving us a chance to find it maybe after a week or 2 weeks, and then find those chains of transmission and stop them. So those two measures in combination, the case finding and the social distancing, are working really well. And the people of Hong Kong are doing a great job as well. So it's not only the government measures, but also the voluntary changes in behavior. People stay at home more often, everyone's wearing a mask outside, hygiene's much better. All these play a role in bringing transmission down to a low level so that we don't need lockdowns.
Now, so Professor Yuen Kok Yung, who's also with the University of Hong Kong, now he said that we're now seeing a second wave in Hong Kong, right, the returnees. He said, brace yourself for a third wave, because as mainland China opens up, and people start to travel, and he pointed to the fact that there were some domestic cases in Guangdong province in the past couple of days, right? Right. That means that virus is still spreading. People have no symptoms and they're spreading. And if they start to come to Hong Kong, we could see a third wave.
So in China, they had a lot of infections in February, which have come down now to a very low level. I don't think they went down to zero, just a very low level, maybe below the level that can really be picked up easily. Mm-hmm. At the same time, they're now having importations, just like Hong Kong had, into different parts of China. And we know that just
but some of those apparently were domestic cases.
Yeah, right. So there's going to be some spread from the importations into the local communities, into Guangdong, into other parts of China. In Hong Kong, we're stopping those from spreading before we pick them up with the social distancing. So we are looking for cases. We're also doing social distancing to slow down the spread, give us a chance to catch up with it. In China, they're doing case finding, but they're not doing so much social distancing anymore. So I think it won't be enough to stop a second wave.
If they're not doing social distancing, surely there will be a second wave, right?
That's the presumption. I mean, we'll see.
You think that's going to happen?
I think that's going to happen. I think we'll see within the next month, the numbers will come up, but there won't be an explosion in cases. It'll be a gradual increase, and maybe the Chinese authorities will then put back in some of the social distancing to slow it down again. But
is it wise not to do social distancing now?
I think it's always difficult to explain why you're doing something as a preventive measure when people haven't seen what's the consequence if you didn't do it. You know, if you had a time machine in New York, of course, you could go back to 2 months ago and say we should start doing things now. But at that time, 2 months ago, maybe early February, They didn't know there was a lot of infections there, but there were, and they were spreading. So if the governor of New York had said, we're going to do a shutdown now, people would have said, why are we doing that? There's no cases. It wasn't until later, now the case numbers are coming up and up and up, that they've done this intervention, but it's almost a little bit too late to have stopped at least, some of the hospitals getting full up.
Should we open up or relax the borders with mainland China now that they say that their numbers are down?
I think we need to keep a close eye on how the numbers are changing over time. And I would say if we're thinking of changing the border regulation, it may not only be for mainland China, it may be for some other places as well that are keeping the numbers at a low level. For China, I think give it a little bit more time just to see what's happening with this current indication that the numbers are going to come back up again, because it would be...
You expect them to come up again?
I expect they're going to come up again in the next month, the next 2 months. I don't think we'll notice at first. I think for the next month, the numbers will still look low, but there could be more infections that haven't been picked up. That's certainly what's happened in other parts of the world. That, initially there's just a few, you think it's not so bad, and then it's only a month later, after the importations have started, that really the case numbers pick up to a detectable level. And for Hong Kong, we don't want that third wave of importations, because every time there's a wave of importations, we have to tighten things up.
Sure.
That's what we just did.
Quick break. See you soon. Don't go away. Thanks for staying with us. This is Straight Up. With me is Professor Ben Cowling from the University of Hong Kong. Now, you say don't close the borders, don't open the borders just yet, right?
We can look at the measures
China.
And then look at what's happening in different parts of the world and then judge accordingly. But I think if we were to have a surge in imported infections again, it would put the public health system under a lot of pressure, because there's a team of experts who are doing the contact tracing and arranging the quarantine. That's fine when there's 10, when there's 20 a day. When there's 50 a day, it gets really difficult. If there's 100 a day, it gets really, really, really difficult. And we don't want to be in the situation of Singapore, where they were keeping things relatively under control like Hong Kong, but somehow it slipped a bit. And then the other day they have 100 cases.
Yeah, that was going up quite...
It's gone up really a lot. And we don't want to be in that situation. We've got to keep things under tight control so that we don't then need to jump to more drastic measures suddenly. Let's keep it more balanced in the coming weeks. Maybe think about relaxing the measures if we're sure that conditions stable in mainland China or in other places that we might choose to relax the incoming
Now,
traveler.
in the US, the cases are really rising quite dramatically. You've got I think 300,000 cases or so, with about 10,000 deaths, I think, right? Thereabouts. I mean, the numbers just keep on changing. But then when you've got 300,000 cases and you've got around 10,000 deaths, the ratio doesn't seem that high, right? But Donald Trump, the president, says expect horrendous numbers of deaths. So they're expecting the cases to jump even more, right?
Yeah.
So, some figures were 100 to 200,000 deaths. Does that sound realistic?
I think what we're aware of is that with epidemics, they start off slowly, but when they pick up steam, they're doubling every week with coronavirus. So at the beginning, it goes from 10 a week to 20 a week and then to 40. But then it goes, when it gets later in the epidemic, it's 100,000, then it's 200,000, then it's 400,000 and so on. And the numbers just keep going up and up and up. And it's really difficult to slow the epidemic down once it builds up ahead of steam. So in the US, some parts are doing these lockdowns, they're doing the control measures. Other parts are not. And I think it's going to be very difficult to slow down the epidemic in the US dramatically. It's going to keep going and going and going. And so the deaths now is a few thousand. In a couple of weeks' time, 10,000 maybe. 2 weeks after that, even more.
So you think 200,000 is possible?
That's an estimate that was made by some experts in the UK and the US based on the mortality rate of between 0.5% and 1% of infections. If you have millions and millions of people infected, then you get a lot of deaths. That's the reality of this kind of infection, which is severe. And that's why we're trying so hard in Hong Kong to keep it out, because we don't want a lot of people infected, and then the health consequences of that with a lot of people getting sick, going to hospital, in intensive care, and then a small proportion dying, of course. It's a very small proportion.
Sure.
But when you have millions of infections, that's still a lot of people.
Well, you know, in Wuhan, China, Hubei province, where it first started, the country now says that they have more or less conquered the virus, and that there are 80-something thousand infections, 3,000 plus deaths. Some people have questioned those figures. I mean, you're an expert in this. You track these kind of diseases, as you say. How realistic are those figures?
So we know that in any country, whether it's mainland China, whether it's other parts of the world, the numbers of infections will be undercounted, the number of deaths will be undercounted. We know that for sure. In China, it's difficult to say to what extent there's been undercounting, because there's a few different ways in which the undercounting can occur. For the deaths, some people couldn't even get into hospital. And that's not only true in China, that's true in Italy, that's true in other European countries, and I'm sure it's true in the US. Later on, there'll be information available from the vital statistics, from the birth and death registry, that says how many people have been dying, what are the causes of death, and we can go back and look at it and see what really was the impact. And remember that the impact of coronavirus on mortality is not only the people with pneumonia, intensive care, you know, and died from the pneumonia. It's the people with a heart attack who couldn't get to the A&E. It's the people with other conditions that couldn't get the surgery or couldn't get the medical care they needed because the hospitals were already full up with other kinds of patients. So there's a really big secondary effect of coronavirus. In terms of infections, China's actually done a lot of testing. In February, they were going door to door in the community, looking for people in Wuhan who had a fever and other symptoms and testing them in their homes. Nowhere else in the world has been doing that. So I think they picked up a lot of infections at that point, but earlier on, there were certainly more infections than anybody realized. I think in the early days in January, there must have been more infections than were detected, and that's because there wasn't enough testing to be used on everyone. So, I mean, I'm sure that anywhere in the world, there'll be more infections than there are confirmed cases.
Well, the mainland Chinese government has taken a victory lap and saying that they've conquered it. Do you buy that?
Well, they've certainly done a good job for the first wave to get it down to low levels with enormous disruption to their economy and to their society. What's going to happen now as they reopen is the risk of a second wave. So there's been probably some infections that didn't go down completely to zero in Wuhan and Hubei province. And at the same time, importations, like in Hong Kong, importations from people coming back to China, bringing infection, some leakage into the community. And if they're not able to get on top of it, it will spread, and that will be the start of their second wave. And the process for that, if you remember in Wuhan, most likely started in November, December, and it wasn't until January it was picked up, February that it peaked. That's 2 months. So if it's coming back in now, there's still another 2 months to go until it's really going to come up to a higher level. So there's time to react as well.
I think also they're not counting those that test positive but have no symptoms, right?
Right, but in China, they're testing so many people that they are picking up people without symptoms. We're doing that in Hong Kong as well. So 2 days ago, 28 cases, of which 8 were asymptomatic. That's because we're testing people in quarantine and finding them sometimes before symptoms develop. So of those 8, maybe some of them are going to go on to have symptoms. We know from other parts of the world that for every 5 or 6 cases you detect, maybe 1 would be asymptomatic if you're really doing a lot of testing of people who are exposed. But in Europe, in the US, they're hardly testing any people without symptoms because they're focusing on people that are sick. So they don't even have asymptomatic cases to report. In China, they're now reporting the asymptomatic cases, which is really a good thing, because then we have a better idea of what's going on, how many infections there are. But I think the ratio should be at most probably 5 symptomatic cases for every 1 asymptomatic, because we haven't seen anywhere in the world having more asymptomatics than that. And certainly asymptomatic cases don't drive an epidemic.
Well, you know, if you don't have any symptoms and then you recover, then you've got immunity. Some people say that perhaps absence of a vaccine at this time maybe herd immunity is the way to go.
Well, sure. To get to herd immunity, though, you've got to have a lot of infections. So for us to get to herd immunity in Hong Kong would mean a lot of people getting infected. Some of them would be asymptomatic, but many of them would have symptoms, and there'd be some getting very, very sick. So I don't think we would like to choose that option at this
No,
stage.
the UK wanted to choose that option and then dropped it very quickly.
Yeah.
But I mean, when you say this thing is not going to go away, we've got to wait for a vaccine, which could come year and a half, maybe 2 years. In the meantime, you say people are going to get sick, right? And some of them will recover. That in itself is it's not a deliberate policy to create herd immunity, but it's happening, isn't it?
Yeah, but in Hong Kong, we're never going to get to the levels that we'd need to have herd immunity. You know, we're having 20 cases a day, 30 cases a day. So far, we have almost 1,000 infections, probably past 1,000 this week. But, you know, that's a long way from anything like herd immunity. Even if we imagine that we missed maybe another double the number of cases, if we missed another 1,000, I think it's very unlikely that many. That's still 2,000 people. That's way short of 3.5 million that we need to be infected to have herd immunity. You know, it's far, far short of that.
Are we all going to catch it eventually?
Hopefully we're going to have a vaccine, so we don't need to catch it eventually. Hopefully in a year's time we'll have a vaccine we can all get, and then we don't need to worry so much about it anymore.
But is it like something that's seasonal, you think, that is going to come back?
Yeah, I think so. So I don't think it's ever going to go away. I think it's going to come back again and again. And so we know that there's other coronaviruses that cause the common cold that we get from time to time. You know, get a cough and a cold. 4 particular coronaviruses are among all of the different viruses that cause the common cold. And it's quite possible that maybe 200 years ago, one of these coronaviruses was more like COVID-19. So in other words, in 100 years' time, COVID-19 will be like a common cold virus.
Okay, in about 1 minute, I've got a minute left. If you have immunity, let's say you've got the coronavirus and you've recovered, so you're immune, you can go about your business without wearing a mask and you won't be spreading it to anybody and you cannot catch it, right? How long does this immunity last?
So we don't know, but there's a lot of things we don't know about the immunity, whether it's really complete immunity or partial immunity. I would imagine that someone who's been infected, maybe they can still get infected again, but with a very mild illness, maybe a couple of years later. So it's not the case that someone's immune, they can go about their normal lives necessarily. We'd need to establish whether that's true. And I think if we were going to have that kind of policy, we'd have to be very careful about how we test people for immunity, how not to game the system, you know, and I think there's certainly a lot of talk about this idea of having immune people.
Some people say, you know, if you're immune, then you can go out and resume your life and you can work.
It's going to be difficult to operationalize that kind of policy, I think, in reality. I think we're better to wait for maybe a year for a vaccine, and then everybody can go back to normal.
All right, okay. Thank you very much. See you next time. Good evening.